Hi, I'm Alfredo Hoyos. I'm a plastic surgeon from Bogota, Colombia, and I am the inventor of different techniques and technologies in plastic surgery, specifically in body contouring, the high-definition liposculpture, and the fit mummy and excisional advanced body contouring. We are facing a new era of skin. We're going to have more patients with more skin laxity, less fat, less obese patients, which is good because we're going to have healthier patients. But we are going to deal with a new challenge of these skin loose patients that we never had before. Younger patients, slimmer patients, patients that not only need solution for the body contouring itself, but also for the skin. One of the things that we have to have clear is that the other technologies had a lot of limitations. And from monopolar technologies, it required a lot of time. It required to raise the core temperature a lot. And on the other side, the gas-based technologies, they have inherent problems in terms of the effusion of the gas to some places that we don't want. So there is a gap between what we want as surgeons of a device and what was available. And this gap is fulfilled now with the quantum. That's why it's revolutionary. Why or how quantum is safer than other technologies? So what we wanted is something that has these kind of very tiny ultra pulses, very quick, very fast, and at the same time makes a very high temperature raise. Quantum was created to take every single thing from other technologies that works very nice and get it to the next level. So quantum has a very, very high differences with any other technology that is available on the market. It's safe, it's efficient, but above all, it's very fast. So let's talk about how versatile the quantum is, because it's a device that was created of a wish list. And the wish list is that we could work it under local anesthesia in the office, and it's the same device that we can work it under general anesthesia and do big areas very quick. It's not as painful as other technologies, so we don't have the limitation. What happened before? If you were working in the local anesthesia, you had a very weak technology because patient didn't tolerate it, didn't tolerate a very high efficient technology because it was very painful. With this one, we fulfill that gap. We can work it on the local in your office and later we can take it to the OR. On the other side, we have also the gap of these patients that have very, very small areas to work with that need a very exacting work, a very exacting job, like maybe the areas, some small areas in the face, the gluteal area, the knees. Usually we didn't have a technology that can work both big areas and small areas. So this is a device that is very versatile. Remember, it has two different lengths. So one is 25 centimeters, the other one is 10 centimeters. But with those two, we can work with high precision, the small areas, as well as we can do big areas, the full body. We have now patients that are very happy from day one, but they keep happy. And we have nowadays an objective way to kind of promise the patient a certain degree of skin tightening.